All right, well, welcome everybody. Thank you for joining us today for our Going Beyond the Drug-Free Workplace, the employer's role in addressing substance use. My name is Brittany Schutz. I am the Executive Director of the York Opioid Collaborative. And today's training is brought to you by the York Opioid Collaborative in collaboration with Drug-Free Workplace PA and York County Economic Alliance.
Oh, there we go.
And today's presentation is also presented by Highmark. Highmark is a community partner of the York Opioid Collaborative as well as a supporter. And this event is actually in collaboration with the Country Club of York's Charity Classic Tennis Tournament, which will be in middle of July. So today's agenda. Today's presentation will be a quick overview. We have a lot of topics to review that we will not have the time to dive into deeply all of them. What we hope will come of this presentation is continued discussion with community partners, as well as the opportunity for either engagement with your individual organization and more trainings and support as we move along in this process. So today we'll be talking about the pathways to addiction, the role of opioids in the overdose epidemic that we're seeing within our community, how it impacts society, and then how it impacts specifically the workplace, the employer's role, what you can do to help your employees as well as help the community, additional resources that will be made available to you, and then we will have a few minutes at the end for any questions that you may have. You do have the opportunity, obviously, to use the Q&A feature, or you also can type in the chat. And so at this point, I'm going to turn things over to Donna Krieger with Drug-Free Workplace PA, and she is going to begin today's presentation.
Thank you so much, Brittany. I am really excited to be here today. I know we're all zoomed out with virtual trainings and things like that and virtual meetings. However, very thankful I didn't have to go out in the rain today and I could just do it from the comfort of my home. So welcome. I'm going to start with a question. You don't have to answer it. Don't put it in the chat. It's something to kind of get you thinking about. But I want you to ask yourself, is addiction a choice? Now, if I did ask you to answer that question in the chat box, I bet if I was a betting woman, I'm not, but if I was, you would have several different answers for that, right? I mean, everybody has their own idea of what addiction is and their own perceptions. Probably a lot of you have experience in some way or another. Maybe it was a loved one or a friend or yourself. But we have to understand as we move forward that each pathway to addiction is going to be different for each individual. It's a very individual disease. There may be some similarities and there's lots of differences, but there's, a commonality of what addiction is, but there's several ways that can lead someone to a life of addiction. We're going to talk about some risk factors. Now, one risk factor for one person may be completely different for the other, for another person. So it may not be a risk factor for someone. So we're going to just go over four basic ones that seem to be the common risk factors. The first one, and this ABCD formula is a great way to remember it. So age of first use. Okay, what's the big deal? Kids are going to experiment, right? Well, research shows us that 9 out of 10 people who have substance use issues began using substances by age 18. I am not a math major. Math is not my thing, but that's 90%. So why is it such a risk? Well, adolescent brains, our brains, do not fully develop until about 25, 27 years old. So, and the adolescent brain is extremely vulnerable to the effects of substances and how it impacts the brain, which we're going to learn about in a couple of slides. So every year, can't say this enough, every year substance use is delayed during this time of development, the risk of addiction decreases or substance issues decreases. So really, age of first use, one of the risks. A big life change. Now that can mean, again, a lot of things to a lot of different people, but it really is something that impacts your life in a big way. So that could be anything from trauma to adverse childhood experiences to divorce to um, changing jobs to the death of a loved one to a global pandemic, right? To stress. So if you're going through something that is impacting your life in such a big way, that's going to put you at risk, possibly for self medication, which then certainly can put you at risk for developing a substance use disorder or addiction. C stands for co occurring disorders. What that means is many individuals who develop substance use disorders are also diagnosed with a mental or behavioral health disorder as well, and vice versa. So they can go hand in hand. And then finally, your DNA, right? Family history, genetics. Genetics can account to up to 75% of your vulnerability in developing a substance use disorder. So for today's purposes, we're not going to go real deeply into that, but I do want to highlight one kind of a big life impact, and that would be chronic workplace stress. If I put it out there for anyone to answer this question about their stress levels at their job, I'm sure you'll all say, I don't have any stress, right? Right, Brittany? There's no stress in my job. Well, we know that's not necessarily true. But what you probably didn't know is that 40% of working adults either struggle with a mental health or substance use issue. And untreated mental illness in the workplace costs an average of $105 billion each year due to lost productivity. COVID-19 obviously has only exacerbated this issue, and only 1 in 6 employees reported that they felt supported during this pandemic. And we're going to kind of see the ramifications of that ongoing for a while. Substance use in the workplace costs an average of $25 billion in healthcare costs. So we know that if chronic workplace stress is not managed in healthy ways, it can really lead to self-medication, then tolerance, then dependence, then addiction and a substance use disorder. Brittany's going to talk about what we are experiencing now, and that is the opioid epidemic.
Thank you, Donna. So this graphic just kind of shows you nationally what is happening when it comes to opioid epidemic. On average, 136 people lose their life every day from an opioid overdose. This includes prescription opioids. This includes illicit opioids such as heroin or fentanyl. And this has been a trend that obviously we've seen here in our community. And this comes from the Centers for Disease Control and Prevention. Next slide, Donna. So when it comes to the opioid epidemic, what are we talking about? We're kind of talking about 3 waves in terms of how opioids have impacted our community. Earlier on in the epidemic, starting in early 90s, we saw this increase in prescribing patterns. We saw opioids being pushed out as a treatment for acute pain. Prescribers were told that these were safe alternatives to treat pain within their patients. And we saw this push for these opioids in the community. And then we saw obviously an increase in prescriptions. After a steady increase in overall national opioid prescribing patterns, we saw starting in 2006, we really started to increase. The total number of prescriptions dispensed peaked in 2012 across the United States at more than 255 million, which was a dispensing rate of 81.3 prescriptions for 100 people. So 81 for every 100 people, opioid prescriptions were prescribed in our community. We are now, so as we saw those opioid prescriptions obviously increase, we then saw the second wave, which was a rise in heroin, which kind of really started in 2010. Here in York County, really started to see that in 2014. Opioid prescriptions, people were getting prescribed opioids, whether it be for acute or chronic pain. Over time, they saw those prescriptions not providing the need they had, or either they got cut off So now they were moving to illicit opioids such as heroin. Um, we then started to see this change in terms of the drug supply. We now saw illicit opioids such as fentanyl start to be more readily available. And a lot of what people were accessing in the community were synthetic opioids such as fentanyl. So that purple is synthetic opioids. And we saw that increase obviously starting in 2013. And a lot of what we're seeing here in York County in terms of opioid overdoses, a big contributor to them is fentanyl. A lot of experts are now saying we are actually in the fourth wave of the opioid epidemic, which is polysubstance use. We're seeing overdoses with different substances present, opioids being a significant contributor, but mixed with others, such as stimulants. And so this chart doesn't reflect that, but we're kind of moving into the next wave in terms of the overall opioid epidemic and how it's impacting. Next slide, Donna. So this slide kind of breaks down where we stand in terms of national data, Pennsylvania data, and then local data. 2014, like I mentioned, was the first year here in York County where we really started to see significant spike in overdose deaths. And that is actually when the formerly called the Heroin Task Force, now the York Opioid Collaborative, was formed in 2014. Prior to last year, 2017 was our most significant year in terms of overdose deaths. And then we started to see a decline in 2018, 2019. We started to see a lot of these efforts that were being implemented in the community start to take effect. And we saw a decline in overdoses. Unfortunately, as Donna spoke about a little bit earlier, the pandemic only exacerbated what we were seeing. And so 2020 was our worst year to date when it comes to overdoses here in York County. I will say not nationwide, that data is also trending the same. Unfortunately, I don't have that data available. It's still preliminary data, but we saw the pandemic impact communities across our Commonwealth as well as across the country. So it definitely impacted residents here in York County and other communities as well. So you can see the trends in terms of how we compare to Pennsylvania as well as the rest of our country.
Thanks, Brittany. And just another way of looking at it of why there's been such an increase in overdose deaths is you heard Brittany mention fentanyl, which is being manufactured illegal over in Asia and brought over here. Fentanyl is a highly addictive, highly potent synthetic opioid that takes a very, very small amount for someone to overdose and die. She mentioned that substance epidemic that we're that fourth wave, we're seeing more and more substances like cocaine, methamphetamine, even marijuana is being cut with synthetic opioids like fentanyl without the user's knowledge. So that's going to put them at risk, right? We also have seen a lower tolerance, and this is partly due the pandemic has exacerbated this because many people in recovery and or wanted to self-medicate, they didn't have access to support groups. They didn't have access. A lot of them were in isolation. And so if they had a setback in their recovery and started using at the same high dose that they used to use, their body's just not going to be able to handle it. And we've seen an increase in self-medication. You can get anything you want on the internet. You can get illegal drugs through the dark web. And we know that the isolation during the pandemic has just really it's been tragic, really, in terms of substance use and the opioid epidemic. So how do we make sense of all of this? What is addiction? What is substance use disorder? How do we get from being at risk to having this disease? Well, addiction is a disease. The good news is it's a treatable disease, but it is a very complex medical disorder. It's defined as having a chronic relapsing disorder characterized by compulsive drug seeking, so they have to get the drugs, continued use despite harmful consequences. And it does impact the brain and has long-lasting changes in the brain. It really is considered both a complex brain disorder and a mental illness. So we're going to talk about how it impacts your brain. Your limbic, and it affects, there were two doctors in 1994 that actually ran PET scans and showed the effects on two very specific parts of your brain, your limbic system, which is right back here, and your prefrontal cortex here. Your limbic system is responsible for our basic survival instincts, right? So when we participate in something needed for our survival, like food, water, shelter, sex, caring for our young, our limbic system activates in the release of a feel-good chemical called dopamine. And it creates this reward pathway that reinforces our survival motivations. So that means that if it feels good, it must be good for us, so we have to seek it again. It really is our survival hardwiring. That reward pathway is then sent to your amygdala and your hippocampus, which records a memory of that feeling. So we do indeed seek it again because it's vital for our survival. The difficulty is that when we introduce substances, they produce much higher levels of dopamine and actually activates the same reward pathway that the limbic system activates, and it reinforces that reward pathway. So substance users do indeed seek it again and again and again. But what happens then is the dopamine and the substances actually hijack the brain. There's so much dopamine, your brain doesn't know what to do with it, so it has to create more receptors to handle all of that. And so it weakens your prefrontal cortex, your thinking brain. That's responsible for all of your executive functioning skills like impulse control, decision making, critical thinking, organization, being rational, and it changes our behavior. Your prefrontal cortex and your limbic system are no longer communicating. And in fact, over time, your brain no longer produces dopamine naturally. So things that used to give you enjoyment no longer give you enjoyment. And you actually need that manufactured dopamine through the substances to not only try to get high again, but really just to feel normal and to survive. And it's impacting our workplaces and our society. So we saw some data on that. Here's some pretty significant data here, and this is all through SAMHSA. It's estimated that over 60% were of individuals in 2018 were past month users. Every year, more than 95,000 people die from an alcohol-related death in the United States. And the preliminary data, the data that we have from the CDC so far, is that more than 88,000 have died from an opioid-related overdose in the last 12 months from up to October 2020. And how does that impact the workplace? Well, more than 70% of all adults with either an illicit drug use disorder or an alcohol use disorder, binge drinking, are indeed employed, whether that's part-time or full-time. And for your workplace, these are some staggering statistics too. Up to 50% of all of your worker compensation claims are due to substance users impaired in the workplace. Substance users incur 3 times higher medical costs than non-users. Substance users are 2.5 times more likely to be absent from work than non-users. And your productivity, approximately only 67% of your potential is being productive if, stumbling over my words, substance users are only about working 67% of their potential productivity. That's what I wanted to say. And unfortunately, it's reported that 80% of employees that are substance users are stealing from their employer to support their addiction. So it brings us to, what can we do about it? What exactly is the employer's role in all of this, in this epidemic and moving forward? Well, really, it starts with your drug-free workplace. And what is that? And what does that look like in 2021? A drug-free workplace is not about catching people doing drugs. It really is creating a safe and productive working environment, right? It's going to promote the health and well-being of employees. It's going to offer treatment for recovery and other help through the EAP. A drug-free workplace protects your assets from theft and property damage because you have this program in place. It provides training for not only your employers, but your employees, but also your supervisors. And it's going to comply with the Drug-Free Workplace Act of 1988. So really, it's about empowering employees to take care of themselves, educating them on the risks of substance use, giving them resources to get the help they need, even preventatively and also as a result of their substance use. It's also really educating and empowering supervisors on how to recognize signs and symptoms and how to direct someone to getting help. What can they do to be part of that process? And it really all starts with a solid drug-free workplace policy and having that in place. So your drug-free workplace policy should focus on your purpose, your procedures, the consequences, and resources. You're going to want to have your purpose clearly stated of why do we have a drug-free workplace program. You're going to use clear and concise, non-stigmatizing language that defines terms like reasonable suspicion or being under the influence. You're going to have your procedures of what's going to happen if you come to work impaired and what that drug testing procedure is going to look like, right down to the very detail of the transportation to and from the lab and to and from the person's residence, the employee's residence. What are the consequences of violating a drug-free workplace policy? That's something that's going to be different for each industry, depending on what regulations that you have to follow. But having the employees understand the consequences of is a deterrent because people need their jobs. And then how are you handling confidentiality? That needs to be addressed in your policy as well. Your resources, not only if the employee assistance program, but if you have local resources that we can give you at the end of this presentation, should be right in there so it can be easily accessed. And of course, you're going to want to have a signature page to ensure and to certify that every employee has received a copy and that they have an understanding of what your policy is. If you don't have a current drug-free workplace policy, or if you would like to just kind of update it or look to see if that you're hitting all those points, we do have on our website a policy builder. And we also have sample policies. So our policy builder it'll ask you questions and you just answer those questions as you go along, and it can generate a policy for you. The sample policy is a downloadable Word document that you can change to fit your specific needs as a workplace. So if you don't have one, or if you do have one and you want to just kind of compare, please visit our website. We actually have lots of tools and resources on there as well. So moving forward with your role as well outside of that policy, it really is, how do we go beyond the drug-free workplace, right? Well, there really is a formula, believe it or not. One of the easiest things you can do is reduce stigma. And then you're going to invest in prevention, and you're investing in support, and then you're going to invest in recovery. So let's talk about stigma first. This is a great resource. This is called the Addictionary, and it really helps us to learn how our words impact individuals. Substance use disorders and mental health disorders, even if you're not diagnosed, even if you're just struggling with substance use, even if you're struggling with mental health, they are highly stigmatized. And a lot of people do not get help. It's a major barrier. It's actually one of the biggest barriers of why people do not seek help or treatment. And so as employers, we need to learn the language that will empower others to seek that help and to seek support and to seek treatment and really to seek recovery. And that's just one of the most basic but vital and tremendously important step in the role of the employer addressing not only substance use but also mental health. So our language matters. We want to use first person language that focuses on the person and not necessarily the issue or the disorder. So prevention, what can we do? How can we prevent someone from making that choice? Well, there are some things that we can do. And really, one of the easiest ways to is provide education for your employees, not only about the risks of substance use, but also about health and wellness, including financial wellness, emotional wellness, physical wellness. Provide education on workplace safety, how to be able to perform their work in a way that is safe, not only physically, but also in a way that's safe emotionally and mentally. Now, obviously, different industries will have different safety trainings, but all workplaces, right, need to feel safe and have safety procedures in place. So, safety committees are really a great way of implementing safety practices. Another one is having a policy in place and using best practices when addressing things like how to execute reasonable suspicion appropriately and with not stigma and not judgment and fact-based information. How to execute drug testing procedures using best practices and integrity and confidentiality. Um, Return to work agreements. What does that look like? And how can that be part of a prevention piece in your policy? We also have on our policy builder and our website what a return to work agreement could look like for you. Um, and then investing in health and wellness programs. And it doesn't have to be expensive to do that. You can invest in health and wellness programs like the employee assistance programs, right? That's a confidential service that helps employees and their families address work related and non work related issues. It really can be a preventative issues of helping them cope with that chronic work stress or other big life changes in their lives. Um, or really just maybe, I don't know, I'm kind of Brittany, I didn't really plan on this, but just brainstorming here, but offering a yoga class in the morning or some kind of exercise class during lunch break or having challenges that encourage employees to drink lots of water. You can be really, really creative and you can be really have a good time with this. Um, Maybe even provide employer wide positive affirmations at the beginning of each shift. But it really comes down to having a champion, this top down approach that not only shows employees that you care about their well being, but that you care about their experience at work and that you want it to be a good experience and a healthy and a safe experience. And it really does send that strong message to your employees that you care about their overall well-being, and it will pay off in the long run with more loyal, more productive, and healthy employees. The other piece is staying or not staying, supporting the employees that have. How do we support? Yes, through health and wellness, but it's really important to provide resources. And when I talk about resources, it is something that an employee or you can access to help that person navigate whatever issue they're dealing with. And resources should be everywhere. So you can have a list in the bathrooms and break rooms. You can have a list in common areas. It can range anywhere from a crisis hotline or a suicide hotline to the Get Help Now hotline that we're going to talk about at the end of this presentation. Certainly, you should have your EAP hotline available. And why do we want it to be everywhere? Well, because a lot of employees don't go to their employers to ask for help. a lot of employees feel that if they went to their employers to ask for help, that it could impact their job negatively. That maybe they would lose their job if they said, I have a problem with alcohol or I'm struggling with depression. But providing these resources wherever they can access them, and making them readily available says that you are supportive and that they can get help. And it's okay not to be okay because they're not alone. Um, I would also encourage, having open door policies that if someone is struggling, that they can go to a specific supervisor or HR department. Um, and I want to talk about the employee assistance program. If you do not have one, please reach out to me, and because we are part of Access EAP, which an EAP program is part of a drug-free workplace program, and many companies do have them. And it is that voluntary service, no cost to the employee. They have about 3 sessions, and then the health insurance typically picks up. It's a 24-hour, 7-day-a-week service that they can access. Many companies have them, but many employees do not know about them. Or if they were told about them during their new hire orientation, it's not even a thought in their head because a lot of times employers don't promote it. So how do we change that, right? Maybe, I don't know, an email blast just reminding them, hey, it's been a tough year. Don't forget we have this service. It's going to be free of charge for the first however many sessions that you need. Maybe putting posters in the common areas of your specific EAP program, having individual brochures for each employee at the time of their new hire, so that they can have it at their desk or in hand, but then reminding them, because a lot of times brochures get buried somewhere, right? So they may not be able to dig through it. The other thing I want to share with you today is something that I'm excited because I've been wanting to do this for a very long time. And now with our new grant funding, we're able to do it, and it's going to begin in July. But it's a new program called Mental Health First Aid. Now, everybody has heard of first aid, right? CPR, what to do in case you get burned, those kind of things. Well, mental health first aid training trains employers and employees on how to identify, understand, and respond to signs of mental illness and substance use disorders. It provides the necessary skills that not only supervisors but coworkers need to reach out and provide maybe that initial help and support to someone who may be developing a mental health issue or substance use problem, or maybe even is experiencing a crisis in that moment. And it's not it's just like first aid. You're not going to perform surgery, you're not going to do counseling, you're not going to do any kind of clinical treatment. But what it's going to help you do is recognize if one of your coworkers is struggling and give you the tools on how to handle that. Because sometimes, we don't know and we don't want to broach it with someone, but this will give you actual, just strategies on how to help. So I'm really excited about that. If you would like to learn more about that, please reach out to me as well. And these really are just some of the ways that an employer can support their employees. But remember that empathy and compassion go a long way when working with people. And so that really can be the start of your support. I also need to talk about recovery, right? And a lot of times we don't know, or we're kind of scared of that because we don't know what recovery is or what it looks like. So really, recovery is discovering a new pathway. We talked about the pathways to addiction. Well, this is a new pathway out of addiction. And it really strives to improve one's health and well-being outside of substances. It's living a self-directed life, not a life directed by your addiction. And it really is this pathway of helping an individual achieve one's full potential. And so it has 4 major components: health, making healthy choices; home, having a safe and stable place to live, purpose, contributing to society, employment is key in that. Many people in recovery attribute their uh, recovery and their success in recovery to their employers. And then, of course, community. Recovery doesn't happen in isolation, it happens in safe social networks. What are the benefits of having people in recovery for your workplace? Well, people in recovery are thankful for that chance to have purpose. And so they contribute to the workforce. Absenteeism is down, they're going to show up. Healthcare costs are down because think about the four components. Health is the number one. There's going to be a reduction in criminal activity because they don't have to support their drug addiction or alcohol addiction. Some statistics here: workers in recovery miss 13.7 fewer days than workers with an untreated SUD, and help an employer avoid over $8,000 each year in turnover costs, replacement costs, and healthcare costs. Many employers that we work with, because we have a program called Recovery Friendly Workplace, are finding value in becoming recovery informed and recovery centric and recovery friendly, because of not only the cost benefits, those are great perks, but also because it's showing a strong statement to the commitment you have to the well-being of your employees, but also it shows a strong statement to the community that you are going beyond a drug-free workplace and are being part of the solution in the solution of the substance use disorder epidemic. So really, as we think about the employer's role in going beyond a drug-free workplace, it's not as difficult as we may think it is. It really is just shifting our framework of how we invest in our employees. Because really, at the end of the day, if we invest in our employees, they're going to turn around and hopefully invest in us, which then, of course, will meet your bottom line. So with that being said, Brittany, we are going to talk about some resources, and I will let you go ahead and talk about the few resources that we have here. And then I can talk about mine and you can talk about yours.
Thanks, Dada. So on this slide, we just have a few resources that you guys can make available to your employees, or if you would like to obviously get more information about any one of these services. So the first thing on here is how to access drug and alcohol treatment support. Dada referenced earlier the Get Help Now hotline. This is a statewide hotline available through the Department of Drug and Alcohol programs that individuals can contact to find local drug and alcohol treatment providers. They can also use it to find local pharmacies that might carry naloxone and other available resources to them if they're struggling with a drug and alcohol addiction or their loved one is struggling with a drug and alcohol addiction. That is available through the 1-800 number as well as an online application. Locally, we also have the WellSpan Warm Line. This is another resource available to our community for individuals who are looking for local treatment, or they just want somebody to talk to about how to navigate services. In addition, here in Pennsylvania, we have what we call single county authorities. These are the local level to our statewide Department of Drug and Alcohol programs. And they're another resource to the community to find local providers, as well as if you do not have insurance, the SCA or the single county authority can be a good resource, and that is York Adams Drug and Alcohol Commission. And then the last resource line here is the White Deer Access Center. If an individual is experiencing withdrawal symptoms and they're looking for emergency detoxification services, this is a number you can call to find that resource. We also have on here York County Economic Alliance, obviously for workforce development, as well as their Prepared York website has resources for local nonprofits as well as employers. The National Institute for Occupational Safety and Health has an opioid in the workplace toolkit. that you may access. And obviously it has resources on how to establish policies as well as implementing programs. And then Substance Abuse and Mental Health Services Administration, also known as SAMHSA, also has a drug-free workplace initiative and carries over into some of the work that obviously Drug-Free Workplace PA is doing. I just want to, I said this in the beginning, but also just remind everyone, today's training was meant to be just an introduction to these topics. We could obviously spend a lot of time on any one of these pieces in more detail. So if there's questions that you have about anything that I share, anything that Donna shares, we're here as resources. We would love for this to be a platform for future discussions and future engagement with our local employers, and whether that be through establishing policies for your specific workplace, talking as a community on how we can do better to support our employers, which will then support employees in the community. We just really hope this is a starting point for those future discussions.
Yes, Brittany, thank you. And so just a little bit about us. Drug-Free Workplace PA has been established through grant funding with the Pennsylvania Commission on Crime and Delinquency. We are going into our 7th grant year, which is very exciting, and we provide lots of different resources. So I talked about the policy builder, but we also have workplace education on site. We are starting to travel more, and I love going to workplaces and engaging that way. But we also have family education too for working parents. So that might be something that you might be interested in. We have an employee assistance program that we can talk to you about. Some specific tools and resources on our website. We have a reasonable cause guideline for supervisors. We told you about the return to work agreements. We have education on medical marijuana in the workplace, which is a very hot topic and is one of our popular trainings. But we also have a fact sheet listed there, so you can do a quick reference. I talked a little bit about our recovery-friendly workplace initiative, and that really is just identifying and training employers on how to be recovery-friendly. I have an EAP. I guess I really like EAPs, Brittany, because I have it listed here twice. That's how important it is. And then, of course, I talked to you about the mental first aid. So my contact information is going to be at the end of this presentation, but I'm going to hand it back over to Brittany so she can talk about what York Opioid Collaborative offers.
Some of you may be familiar with the York Opioid Collaborative, and some of you may not. So the York Opioid Collaborative is a local nonprofit. We work as a collaborative body to bring together local partners. We're representative by a wide range of stakeholders along the substance use disorder, opioid use disorder continuum. So that starts all the way at prevention up into recovery. So Drug-Free Workplace PA, York County Economic Alliance, are all partners of the collaborative. And what we do is we work to coordinate efforts in our region to reduce overdoses and reduce the impact of substance use along those 4 areas that I just mentioned: prevention, rescue, treat, and recover. So as a collective body, we're constantly looking at how do we engage with our stakeholders, our community partners, to improve the health and well-being of our community. And the York Opioid Collaborative, our website, we obviously have resources available, ways to get involved. As local employers, we would love for you to be involved in the collaborative. Be a part of our stakeholder advisory groups. Let us know what's happening in the workforce. What are your barriers? What is things that your employees need to be successful? And what do you need as an employer to be successful when it comes to dealing with substance use disorders or opioid use disorders among your employees, and then obviously among the community. We have resources available on our website. A lot of the resources that I listed earlier are also on our website, as well as resources for health professionals, resources for first responders, learning opportunities. If we're ever doing another presentation, that will be available on our website, as well as local prevention initiatives. Again, the collaborative, we're a collective body. We work with community partners to fill in gaps, to identify new opportunities, and to move forward with systemic change to address substance use and opioid use disorders in our community. We also have a bi-monthly newsletter, so it's a great opportunity to stay up to date on what's happening with the collaborative or with community partners. So you can all sign up for that on our website.
Okay, so we can start taking questions now. And while we do that, just wanted to give you our contact information. So this is mine. I'm available any time. I would be happy to talk with you about any of your needs or questions. But also follow us on like LinkedIn and Facebook and Twitter and Instagram, because we do have resources available there as well. And we do a lot of discussions. And so it's a great place to learn more about drug-free workplace PA. And this is Brittany's contact information. I think she has a Facebook page too. Okay.
Yeah, you can follow the York Opioid Collaborative's Facebook page, Twitter, Instagram, as well as you can find me on LinkedIn.
Yeah. Awesome. So I think, I mean, again, what Brittany said was that this was just an introduction of it, but if you were interested in any more topics that we discussed, we have deeper presentations on that and trainings on that. So we're just kind of open it up for questions and go from there. And if you don't have any questions, that's okay too. We won't be offended.
But I did want to allow our partner, York County Economic Alliance, if they had anything they would like to share with the group. Again, this is a partnership. What makes us successful and the way we're really going to improve our community is by working together. So YCA, I don't know if you guys have anything you'd like to share.
Sorry, I was having some technical issues. Hey everyone, I'm Sue Lee. I just wanted to share that certainly we are here and happy to be partnering today on today's session. And one of the other resources that we have recently launched is the Pathways portal. And that is yokopathways.com. We can add that into the chat and include it in the follow-up email. But again, just another resource we can highlight and list available opportunities for employment training, much more, and great referrals and connections to the York Opioid Collaborative and organizations and resources like Donna. So we're thrilled to be partnering for this session, and again, happy to help share this to all of our employers across the county and through our membership footprint.
Thanks, Lily. If we don't have any questions, this training will be is obviously being recorded, will be made available for you to watch at a later time if you want to go back through it. Our contact information is included on the slides, as well as we could probably get that sent out with the recording. So at any point, if you have any questions, feel free to reach out to any of us. We're here as a resource.
Okay.
Donna, do you have anything else you'd like to add?
I don't. I just hope this was informative, and I'm looking forward to partnering with York County and how we can really kind of make a difference together.
Again, thank you everyone for taking your lunch hour to join us. I hope this was informative and helpful to you. And hopefully this will just be that launch pad for future conversations and ways we can partner to help improve your workforce and then improve York County. Thanks, everyone.